Next thing is psychotherapy. Since we are dealing with psychiatry, psychotherapy, we all know what happens in a psychotherapeutic sessions, right? So what happens, a patient might present with a psychological disorder or some kind of mental disorder, through which now there is an interaction that goes on between the provider and the patient, and the doctor here tries to alleviate the mental and the emotional problems of this patient, where he tries to address it and he tries to reduce it down, right, by way of catharsis, by way of listening to the patient's presenting problems. So here the coding is pretty easy. You need to consider only the time factor. That's all. There is nothing else. There is no difficulty. You need to know it's going to be a case of an individual psychotherapy. So you will have to pick the code based on the time that is being spent. See if it is going to be for 15 minutes, or see if it's going to be 30 minutes, or see it's going to be for 45 minutes accordingly, or 60 minutes. Accordingly, the codes are going to be different. And you should understand here, you don't have a rigid classification as 30, 45, 60. There is a range that is being given in the CPT manual. So please follow the range. If you want to report for the code 90834, then the range would be like 38 to 52 minutes. The range is from 38 to 52 minutes. So see the range and you can easily select the code. Next thing, we have a code for a psychotherapy for crisis. Now there is a life-threatening condition. Imagine the patient is standing on the parapet and is just threatening to just jump out from this parapet. So he is trying to do a suicide attempt. So that's going to be a life-threatening condition, and that time the doctor has to manage this patient. He has to provide some kind of a communication methodology or some kind of treatment protocol, right? So that would go for a crisis, where a kind of emergency or a life-threatening condition. So at that time the physician has to perform her duty. So at that time you can very well report it as a psychotherapy for crisis. Next thing would be an interactive complexity. Imagine the child who has a problem is sitting in front of you. The parents are saying like, my child, I could sense some kind of a problem or behavioral problem. Now they have brought the child to the psychiatrist and the child is not opening up its mouth. Then imagine how difficult would it be for the doctor, or sometimes patients who don't cooperate, people who have language problems, when it requires a translator. So that's going to be really difficult for the psychiatrist to communicate with the patient. At that time, you'll have to report the interactive complexity code. Okay. So in addition to psychotherapy, you should also report the interactive complexity code, and the CPT manual very well lists on what are all the features that can be included under the interactive complexity. Next, we have psychotherapy with or without patient. It can be like a family psychotherapy. Either the patient can be present or cannot be present. It's not always like only the patient should be given the counseling, right? Sometimes even the family members need to be provided the counseling. So that becomes a family psychotherapy. And imagine there is a group of drug addicts. So at that time the psychiatrist would have to present a session as a group psychotherapy. Then you can very well take those codes.